Okay, when this is done loading, we should be good to go.
Thanks, Colton.
Okay, whenever.
Okay, I have a script I'm going to read, and when I get to the names, as Carol alluded to, I'm going to stop, and if you could say that you were present on the call, so they can mark that down for the minutes. Hello, I am Patsy Zeller and serve as the chair of the Education Committee for the Kansas State Board of Nursing. I ask the members of the Education Committee to respond to a roll call signifying their presence at this remote open meeting by Zoom and YouTube. Rebecca Sander. I think she just sent me a note when I was trying to get connected. Let me check real quick here that she was not going to be able to be on the meeting.
Madam Chair, I think she is still in the investigative committee.
Okay. Carol Bragdon.
Here.
Thank you. Mandy.
Here.
Thank you. Christina Rudisil.
Here.
Bernadette Federoff.
Here.
Karen Kidder.
Here.
Dee Blind and Blessed.
Here.
Gita Noble.
Here.
I also ask the following board staff members to signify their attendance. Carol Moreland.
Here.
Janelle Martin.
Here.
Chelsea Stephenson.
Here.
Public comment allows individuals to address the Education Committee about their concerns. However, the Kansas Open Meetings Act, which is known as KOMA, does not require the Education Committee to provide public comment or answer questions from individuals. As we will not know what comments or individuals may make, we would want to provide notice to the public of our intent to discuss a particular matter so that the public may listen and observe our discussion. Public comment will not be taken today due to that concern, and because this meeting is a meeting conducted by Zoom and YouTube, where the connection may be lost at any time for the meeting, may not allow everyone who is present to comment. Because we are conducting this public meeting by Zoom and YouTube, I state for the record the following information. On August 27, 2020, the board sent notice of the meeting of the Education Committee to all individuals who have requested notice of the committee's meetings. Additionally, the notice and agenda were posted on the board's website, ksn.kansas.gov. You can obtain a copy of the notice and agenda at the website or by sending an email to carolmoreland@ks.gov with the subject line request for the agenda, and the board staff will send it to you. The notice contains a link to the Zoom identification number and password and the link for the YouTube to allow the public to attend this meeting free of charge. The notice also advises individuals to contact the board's office at 785-296-2967 if an individual experiences a technical issue during the meeting. Effective June 9, 2020, the House Bills 216 ratified Governor Kelly's emergency declaration due to the COVID-19 pandemic and extended it through September 15, 2020. On September 11, 2020, the State Finance Council extended the emergency declaration to October 15, 2020. However, the requirements of KOMA were not suspended. We will be conducting this meeting pursuant of KOMA and KAR 16-20-1 concerning compliance with the KOMA during the emergency declaration. The connections to Zoom and to YouTube are the only mediums for interactive communication offering for this meeting. Each member of the committee, board staff, or presenter shall state the person's name and title each time the person speaks or votes, as the case may be. Each participant to this meeting shall ensure microphones, phones, or other electronic devices are on mute when the participant is not speaking. Each motion will be clearly stated before the committee votes, and the chair will announce the results of the final vote. A statement or motion will clearly identify and authorize by delegation each member of the committee or staff who will be permitted to sign any document on behalf of the board. The meeting is being recorded and the recordings will be posted on the board's website. The committee has the following items listed on the agenda: call to order, review of on-site packet, additions or revisions to agenda, announcements, approval of minutes for the meeting held in June 2020, nursing education compliance officer report, site visit reports, new business, unfinished business, petitions, agenda for the committee meeting in December 2020, adjournment. The meeting is now called to order and the committee will now consider the next item on its agenda. Okay, so the first thing we have on the agenda is review of the on-site packet.
I don't believe we had an on-site packet this time.
Okay. Thank you for that. Additions, revisions to the agenda.
This is Janelle, the Nursing Education Compliance Officer with the board. I would like to add an agenda item under new business for looking at the undergraduate scholarship essay topic. We've gotten word we're going to be able to do that, so would like to add that.
Okay, we'll put that on there. Anything else that we need to add or revise on the agenda? Hearing none, I guess I need a motion to the, excuse me, to accept the agenda as revised. And Chelsea, is that going to be you to read those motions and somebody says they make that motion? Is that how we do this?
Yes.
Okay, so I'll let you go ahead and read that.
I move to accept the advised agenda to add the undergraduate scholarship topic under new business.
This is Dee Bonenblust, and I so move.
This is Christina Rudisill. I will second.
So I have a motion and a second. Any discussion? Hearing none. Everyone in favor say yes.
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 Opposed, say no. Motion carries. Thank you for that. The next thing is announcements. Janelle, do you have some announcements?
Don't think I have anything new.
Carol Moreland, do you have anything?
The only thing is, this is Bernadette's last meeting. And so we really appreciate everything that she has done being a committee member. We will be sending out a certificate of appreciation to her. Since we're not meeting in person, we can't really give it to her. But I just wanted to say a big thank you to Bernadette.
Yes. Thanks.
I've enjoyed every minute of it, and I'm going to tell you, I'm going to miss it.
I guess I was just denying that if we didn't announce it, it really wouldn't happen, right?
I know.
Yep. Thanks a lot for that, Bernadette. Appreciate your help.
No problem.
The next thing is approval of the minutes for June 15, 2020. Did anyone see anything in the minutes? Everyone got the minutes okay? Saw those from our last virtual meeting we did? Any revisions or changes we need to make there? Okay, hearing none, I guess, Chelsea, we need a motion for the approval of minutes.
I move to approve the June 15th, 2020 Education Committee meeting minutes as drafted.
This is Bernadette Federoff, and I will so move.
This is Karen, and I'll second.
Motion and a second. Any discussion? Everyone in favor say aye.
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 Opposed say no. Motion carries. You guys are doing a really good job so far. This is working pretty good. We're going to go to the next thing. Nursing Education Compliance Officer Report.
Okay, just some updates. We have several either new or returning administrators. Baker, as we heard, Bernadette has retired from that position, and they have a new director, Dr. Mary Hobus, who took over on August 3rd. Butler Community College also has a new interim associate dean, Janet Schuler. She's been with the program a while, but she's acting as their interim dean right now at the resignation of Dr. Eagleton. Highland Community College, Jane Siccardi has retired, And Anna Fowler has taken the role of the interim director for Highland. Mid-America, Dr. Karen Weigman has returned to full-time teaching, so they have a new interim dean. But Sarah Miller will be serving in the role of chief nursing administrator and will be our contact here. Washburn Tech has had a change again. Jane Carpenter has agreed to take over the interim director for them as they search for a new director for their PN and health occupations program. Couple of updates. Dodge City and Seward Community College are both looking at new spots for their nursing program. That's increased their spaces. They're very happy about that. Kind of an odd time for that, but maybe a good time for it as well. A couple of things on the activities for this time. As most of you are aware, we switched to a new process for our faculty qualification reports. Many of you have already used it. It's an all electronic process now, and want to let you know that I've already had over 200 submissions. Well, close to 200 now that have been electronic. I'm seeing a little bit more incomplete, but that's, I think, part of the process. But I think overall it's going really, really well, and we are processing them and figuring out. And Chelsea has been extremely helpful in making that process go smoothly. I think everything else is on there. Kind of working on two big things I'm working on are, and we'll talk about later, are some changes about the annual report, and then and program guidelines. So that's kind of been taking, there's also been kind of an increase in from NCSBN and other regulatory boards, been doing a lot of responding to surveys for them on different topics. I think as COVID has hit, they have all been, as we are, trying to figure out what to do and how other people or other boards are managing. So been a lot of communication with NCSBN and other boards, which has been actually been very helpful in some of this process, getting a lot of good input and kind of seeing what's happening kind of around, all around us and across the US. The other thing is the work of the program directors just here in our state. You all have been very good about submitting what you all are doing in response to COVID, the changes that are going on. And I've been able to maintain a really nice look at what's going on for all of you. So when I get questions from other states about how we're responding and how you all are responding, I'm able to do that. And I really appreciate that. It helps us know and understand kind of what the broader picture is, and to let other states know what the broader picture is too, and maybe even to bring into light some of the things that might be issues. So really appreciate your keeping us up to date on that. And I think the rest is there, and we'll leave it at that, unless there are any questions.
Thanks, Janelle, for that. Any questions for Janelle? Are we good? Okay, we're just going to keep marching through the agenda. I do have one reference, and that was to Janelle had it in her report about the Department of Education. And so requirements that they had with that, that's kind of new for some of us. Janelle and I had a conversation about, she's been working with National Council with some of those requirements. And so we had a conversation early this morning about maybe seeing it, excuse me, if she could reach out and see if National Council had any other tools that the schools might be able to use. They do have all those nurse practice apps on the website. So I think after Janelle and I talked, just to inform the group, she's going to see if she can reach out some more, and maybe we could come up with some more assistance for the schools. That's a pretty big daunting task to get done. And with a little bit of guidance or maybe a cross-reference, a grid, I act like that's going to take 2 minutes to do. It's not. But maybe with National Council's help, Janelle's going to research that and get back to us and let us know. So if I have anything that I could share with the group, I'll share that by email. Not that you need to respond to that, but just so you're up to date with that. If we have anything before the December meeting, it may be December before we have anything to report, but just so you know, we're working on that. If you've heard some about that requirements from the Department of Education. So thanks, Janelle.
Yes, and I hopefully will have something, if there's anything further, I will send it out to the administrators as well to kind of help with that.
Okay, thank you for that. Site visit reports. The first one here is Salina Area Technical College.
Yes, Salina Area Tech, their PN program had a visit in February. It was a follow-up visit after their first graduation. They were a new program a couple years ago. We did that on February 25th and 26th. And Rebecca Sander from our board and I went out to do that visit. From that report, the strengths we identified is they have very strong community support for this program. They have a very good, strong nursing program administrator. They have good acute care clinical opportunities for their PN students. They have a great early alert process for students having difficulties in their program and have a way to help them once they identify them. They have a very dedicated faculty who are very much student advocates and have good communication with the clinical sites. They've remodeled their building to help kind of make it more inviting for students and created a really good environment with their sim lab and their lab facilities and classrooms. The students' view of the program is very positive. They're very positive about the program and the faculty support. There's very much been a student focus of the PN program implementation. They've been responsive to students and to the communities that they're working with. And one thing that we don't see often is their program has a certified simulation instructor. So they're really working well with that. Some opportunities for improvement. Some improvement in the clinical site communication, particularly on a day-to-day basis. They have some things in place for when their students go, but the clinical sites they use have a lot of facilities that use this particular site. So there needs to be really good communication with this from the students and the faculty to them on a whenever they're on site. The faculty orientation process is well documented, but not always followed through with in terms of making sure it's completed and signed. Again, fairly new, but to think about also kind of extending that more so to their adjunct faculty and part-time faculty. Testing policy is in place, could use some strengthening. Really the main point of that was to try to get away from textbook test banks as the primary source for testing. There's also some other pieces that could use improvement, but it's there and they're starting to work with that. They need to clarify the admission policy on advanced standing. There have been a couple questions about that and found that the prerequisite language was not clear. And so it probably would be good to clarify that so it's not in question. And then also to clarify the process to ensure all KSB and required documents are in faculty files. It was mostly complete, but there were a couple places we had issues. So the recommendations are to submit FQRs for all current faculty, full-time, part-time, and adjunct by May 1, which was done. And then approval for the PN program for 5 years with the next visit to be spring of 2025. And any questions?
If we don't have any questions for Janelle, Chelsea, I guess we're ready for a motion.
I move to accept the site visit report with recommendations for Salina Area Technical College PN program and grant approval for 5 years with the next site visit to occur in the spring of 2025.
This is Christina Rudisell. I will accept that motion.
This is Karen Kidder, and I can second.
I have a motion and a second. Any discussion? Everyone in favor say aye.
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 Opposed, same sign. Motion carries. Next, Donnelly College for reapproval of the PN program.
Okay, so Donnelly College PN program was one of the ones that we were not able to visit in April when COVID was kind of at its height at the beginning there, but we were able to reschedule. They had students on site this summer, so we went to do the visit July 15th and 16th. Karen Kidder from our committee and I went to do that visit, and we did do that on site following CDC and social distancing requirements with masks. It's an interesting experience. So the PN program was on a 2-year pre-approval cycle from the last site visit for the board. We were able to get in there and really do some good talking with their administration. They've got a new, or not new, but a strong and experienced director of nursing back at the helm there. They really do have very strong support from their administration, board, community, students. They're all very positive about the role this particular program plays for them and how important it is. They've done a remodeling of one of the Marion Hall there that's on their campus that is going to be entirely dedicated to nursing starting this fall, which for them is 4 floors of, they've been able to expand, and in their social distancing, they're going to be able to do a really nice job with that. They have a simulation lab and they've hired a dedicated simulation coordinator, and are also using that for tutoring and help with their graduates as they wait to take their exams. They have a much more cohesive nursing faculty since the last visit. We've seen a lot of stability built with that group. Their clinical sites are very supportive, and barring any issues with what the CDC or KDHE is requiring, they are doing everything they can to get students into those clinical sites. They started using the revised PN core this fall, and that will include IV therapy. They're trying to kind of stay in sync with the rest of the PN world, even though they're a private college. They have a good process to identify their nursing program needs and to apply for grant funding. They've had a lot of success with that and have been able to maintain their funding for their nursing program. They use the complete ATI program with their students, and the students voice that was very valuable to them and has really helped them. They really like the flexibility of this program. It's an evening weekend program, hours primarily, so most of them work and then do this evening weekend time, and they have found the faculty and program director to be very responsive to their needs in doing that. And their advisory group has really stepped up since the last time we went to visit, and they're more involved. They're very verbal about their support of the program and the progress that's been made. Some opportunities, we still have a little bit of information missing. When we looked at the faculty table, not all the information was there for us, most of it, but not all. We really need to clarify the oral and written English proficiency policy in their nursing student handbook. It's just not clear, but they do have a lot of English as a second language students, and so it's very important to make sure that policy is clear. Also, some clarity on their non-nursing prerequisites and what's expected before they come in versus what they can do while they're in the program. Their Nclex pass rate has not been consistently above 75%, though we have seen improvement over the last 2 years, and with a steady increase. The program evaluation plan we had a lot of trouble with in the past. They have a good new strong template they've developed. They've got data collected and aggregated, and now they need to work on using that data for their program use. But want to make sure there's definitive actions in that, and that clearly reflect the analysis that they're working on. And again, to ensure all KSBN required information in faculty files. So the recommendations for this program: to continue to monitor their Nclex first time pass rate to make sure it's above 75%. Continue monitor process to ensure all faculty files contain KSBN required information. And we recommend reapproval of the program for a period of 5 years with the next visit in spring of 2025.
Any questions? Excuse me, any questions for Janelle?
This is Carol Bragdon. I had a question on our new regs, education regs. Are we still at 75%?
Yes, education regs aren't through yet.
Okay.
So we're still
dealing with the 75%. Yeah.
Right.
And their pass rates for the past 3 years?
They have been above 75 the last 2 years. This last year they were at 80, let me look, 80 something percent. They were just have been a little up and down in their PN until the last 2 years, but
Okay,
on a good incline or upward trend for the last couple of years. Trying to find it in the report here, Carol.
I remember looking at it somewhere where we looked at those statistics, and I didn't remember that it was, but I could be misremembering that they were. where they
Right,
were.
so they were at 75 in 18 and 87 and 87.5% this last year.
Okay,
It was 44%, 75%, 52%.
right.
It was really
It's
unsteady,
been
but
quite low. Mhm.
right. And that's
Okay.
why I think we had the revisit that
So
we,
this year is better, but just really 1 year that's better, right?
well, 75% was at our, and then now up to 87. And I think they're above 85 for this year for 2 quarters.
Okay.
So,
I guess I'm a little uncomfortable with giving them 5 years when
okay.
we've only really had 1 year that we would call adequate pass rates. I don't know how the rest of the group feels, but 5 years seems a long time until we see a more consistent pass rate.
I understand that, but per our regulations, I don't know if we can change that. Because
This
our,
is Bernadette, and it seems like, you know, if we continue to monitor it and they are low, wouldn't we be following up with them anyway? Wouldn't they have to, you know, submit a report and have a plan and so on? So we really, I agree with Carol that it's great progress, just need to make sure it's sustained.
Correct.
And we'll be following that anyway. And if the new regs go into place, it'll really force the issue.
Right.
Mhm.
When
Yeah.
we do every March, we do our look at our pass rates. There can always be a trigger. There are
Okay.
ways to re-trigger a visit, but you know, also if the recommendation, if it's more comfortable to do a follow-up couple of years, I mean, that's up to you. I felt like at least if they stay where they are, and again, anything else, if things happen, if rates fall, if there are other things, complaints go up, whatever, we can also trigger a site visit at that time.
This is Patsy. Do we need to define the word monitor a little bit? Is that where we're struggling? And
I kind of think so. I just don't want things to, you know, drifting down. I'm concerned just because of past history. I'm very pleased to see, and it sounds like they've got a lot of good things in place now, but
We want it to stay.
that's our responsibility.
Right.
Exactly. This is Dee Bonenbless, and Janelle, do you know if they have an unofficial pass rate for the spring of 2020? So it'd be unofficial, but do we know if that trend is staying above 75?
That's the one for the last 2 quarters. They've been above, I think they're at 80. Oh, I'm
That's unofficial.
for sure,
Okay.
but they're above 75 for sure. And I'm pretty sure they're above 80% for the last 2 quarters. Cause I looked at it again, when this went to the packet, just to kind of, to be sure. But those are quarterly rates. And I'm trying to remember they have, guess they started in January. So they would have had some graduate in December. They're one of those that have some that have been a little bit delay in their Nclex testing, but so far so good. And continue to monitor the Nclex first time pass rates too. We do that every March. We can always send a letter to make sure that the plan is continuing as they've written it.
Carol Moreland, can you tell me historically what we've done with the school that may be in this similar situation in the past?
Well, according to our regulations, the current regulations that we have in place, it would be 2 years for them to be below 75%. And then they would get a letter of concern, and then they have to do a report back to us. And it would not trigger another site visit until it's 3 years consistently less than 75. So that's what our regulations say now. Now, when the new regulations go in place, the first year that they're less than 80% triggers a report. And then they would get a site visit for the second consecutive year that is less than 80%. So you do have, you know, monitoring in place, so to speak, but it would be 2 years consistently less than 75% right now before they would have to do a report.
Okay, thanks for that. Does everybody have the questions answered? Are we okay to leave the recommendations like they are? Okay, then I guess we're ready for a motion.
I move to accept the site visit report with recommendations for Donnelly College PN program and grant reapproval for 5 years with the next site visit to occur in the spring of 2025.
This is Mandy, and I'll make the motion.
Bernadette, I'll second.
A motion and a second. Any other discussion? All in favor say yes.
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 All opposed say no. Okay, that motion carries.
Patsy, just for minutes, I'm going to abstain. Sorry, this is Christina. I'll abstain. I'm on their advisory committee.
Sorry, I didn't ask that. Thank you.
No, it's okay. I just went for minutes.
Okay. We'll go to the next one. It's Donnelly College for ADM program.
Right, so we did the, since we were going out and the PN got delayed, we went ahead and did the ADN program revisit. We had done a visit last spring. The recommendation was that they cease admission until there was some stability. So since we were there, we went ahead and they'd asked us to review the documentation that they had. And so we have the ADN 1 year follow-up from their last report, which we did on July 15th and 16th. Again, it was Karen Kidder and myself that made this visit. Since they did not admit students this past year, we were not able to meet with students, but they had done, I did ask them to give us some contact, and we did get some basic graduation surveys and comments from 6 of their 9 students. And so that was the way they were available for this particular visit. Most of them were working and could not make a Zoom visit with us. But what we looked at, this was a follow-up. There just had been so much instability in the program. So we were really looking at their structure and to see what they had done in this past year that might give a change to that. And they also, we put the approval. So the strengths very much similar to what we heard for the PN, because this is very much a core group that are working with both programs, but very strong support for this program, administration, community, advisory board, and students of the program. They now have strong and experienced leadership back in place with their nursing program director. Their resources for their program are strong. Again, the remodeling of the building, the fact that they have all of that facility available for their nursing programs. And they have more computer labs that they've put in to accommodate distancing requirements, more classrooms for the same, to be able to bring them on site as well as do virtual. They have a new resource center in their nursing building to help with some of the tutoring and preparation for testing. They have a sim lab with a dedicated simulation coordinator. They've been able to really ramp that up, use of debriefing in their learning process. They have nursing tutors available. This has been helped by a grant that they were able to get. They have very supportive clinical sites. The location of their program serves a very much needed area, has a very strong mission and vision for success. And clinical sites really like that, and they like the diversity that the nursing students bring to their programs and to their facilities. They have a good process for identifying the program needs and for funding. Again, the use of ATI, the students, again, in the ADN level also voiced that that was helpful for them in the way that it's being used. They would recommend programs to others, even though there were some issues. All of them that graduated this past year felt like they'd seen a lot of turnaround in the program and felt really supported and much more ready for taking Nclex than the group that we talked with a year ago. They've done a lot of work on faculty development and training over the past year. It's really built a confidence and a collaboration within the nursing faculty. They have a lot of diversity in that group as well, and they provide a really nice representation of their student population. They have 4 of their 5 full-time faculty that are returning. The program did keep them on board full-time, even though the program was not admitting this past year, and committed that time to faculty development and some training for them in terms of curriculum and program development. Again, the advisory group really has stepped up and is being supportive and trying to bring more support for the program, as well as the community aspect of the support. They have a new, it's actually, this is in the second year, college-wide system for evaluation, which is really streamlining their process. So they have a strategic plan that's helping in that evaluation process for each of the programs. Nursing is one of them that I believe was done in the first year. So it's a 3-year cycle, and it will help them with their ongoing evaluation. Plus, they put into place a new systematic evaluation plan that has a very strong basis. They use some consultative help to get that accomplished, and have some data that they're now looking at and bringing to their faculty, and doing a lot better with making that full cycle. They are offering ongoing classes and tutoring for the ADN students that were part of their program as they wait to take Nclex. There, like I said, have been some delays due to COVID that they've experienced. Some opportunities for improvement. Again, the faculty table, all the KSBN required information, there's still a little bit missing there that we would like to see. Well, we need to see all of it there. To add the oral and written English proficiency to their student nursing handbook. Nclex first-time pass rate was below 75% for the original group. And they only had 9. So it was a 60% pass rate on the first attempt, but all but 1 passed on the second attempt. So overall, they had all but 1 not pass out of their first group. But to continue to monitor that very closely and look at that. They've only had 1 tester so far in their second group because of the delays, at least the last that I knew of, and that person had passed. Program evaluation plan does show evidence of the collection and aggregated and starting analysis, and now just to follow through with that and using it with their faculty and their advisory and looking at that as for long-term changes. And the other to ensure all KSBN required information is in the files. So recommendations. Really need to continue to monitor, and there's a plan in place for them already to be above 75%, to make sure they have processes to keep all KSBN required information. And at this point, to recommend continued conditional approval for the program. They've got some stability to keep, but with permission to admit students starting 2021 with a follow-up visit after their first graduating class. Felt like the stability issues had hopefully been in place, but to leave them on conditional until we can get a better idea of how pass rates are going to go. Questions? Okay, a message from Patty at Donnelly. I'm sorry, I thought we had her available for speaking, but they have only 1 left to test in their second class, and they're at 87% with 1 left to test. So that's good news. They really did a lot of support for their students after.
I
Colton
think I
just,
got Patty in there.
Colton just unmuted me.
Okay. Thank you, Patty. I'm sorry I didn't see
No,
that.
that's okay.
Any questions for Patty? She's now on, or myself or Karen?
Patsy, you're on mute.
Hearing the silence, I guess we're ready for a motion.
I move to accept the site visit report with recommendations for Donnelly College ADN program, which will allow the program to begin admitting students again, remain on conditional approval, and will schedule a follow-up site visit after the next graduating class.
This is Karen, and I will make that motion.
This is Bernadette. I'll second.
I have a motion and a second. Any further discussion? Everyone in favor say aye.
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 Opposed, same sign. Any abstentions?
I abstain. This is Christina.
Thank you for that. Looks like the motion carries. Thanks, Patty.
Thank
We're
you,
gonna
guys.
We're going to move on to new business, major curriculum change request for Coffeeville Community College.
Okay, the request we have from Coffeeville is they would like to request a change to incorporate IV therapy into the core curriculum that was approved in June 2020 for them. Included the material that they're planning to put that material in their already approved Nursing Care of Adults 1 and Nursing Care of Adults 1 clinical. They are asking for the changes or hoping that the changes will go into effect October 2020 if this is approved.
Is there any questions we have about that? I think we're ready for a motion.
I move to accept the major curriculum change request from Coffeeville Community College to adopt the IV therapy content included in the KSPN core curriculum for the 2020-2021 academic year.
This is Dee Bonenbless, and I move to accept that motion.
This is Christina Rudisill, and I will second that.
Motion, excuse me, a motion and a second. Any other discussion? Everyone in favor say yes.
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 Opposed, say no. Looks like that motion carries. Major curriculum change request for Johnson County.
Okay, so this is from Johnson County Community College, the PN program. They are also asking to include IV therapy in the practical nursing program. They have already adopted the core curriculum, and they're planning to begin IV therapy in the curriculum beginning January 2021. And I think the documentation includes where they're going to put it and also some of their advisory for where that was discussed.
Any questions?
This is Bernadette, and most of this is my ignorance in that this course for IV therapy is within another med surg course. Am I correct?
That is
Right.
correct.
Okay. So Christina, how, if I don't pass that part or I don't do well with it, but yet I pass the course, how's that going to work?
It's all built into the course. You have to pass all of it to pass the course.
Very good.
Yeah, piecemealing gets me confused. So
And wasn't the intent.
Any other questions? I guess we're ready for a motion, Chelsea.
I move to accept the major curriculum change request from Johnson County Community College PN program to include IV therapy in the practical nursing program to begin January 2021.
This is Karen. I'll make that motion.
This is Mandy, and I'll second.
We have a motion and a second. Any other discussion? Everyone in favor say yes.
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 Anyone opposed say no. And abstentions.
I abstain.
Looks like the motion carries. Thank you. The next thing we have is Nursing Programs 2020 Annual Report to the Board.
Okay, in your packet, it's a little bit longer. Sorry, I didn't squish up the information as much. So I tried to put a little table of contents there for you. So the report basically contains for you what our standard reporting is for program admissions, for BSN, ADN, and then I also have a total for all RN together, and the PN, as well as graduation information, articulation information. And I'm just going to make a couple comments on that. You've seen that. We had a little bit of less admissions for our BSN, but we also had a program go leave the state. So that was, it wasn't a statistically significant change in numbers for that. We did see a little bit of increase with the ADN in terms of admissions, but again, overall for RN, we were down just a little bit, but not statistically significant for admissions. For the PN level, we did see a little bit of a drop, again, not significant in terms of statistics, but just a note. It's up overall for 3 years, but a little bit of a downturn from the year before. We've seen admissions go up for APRN programs steadily over the last 3 years. That's page 75. I'm just kind of going through to point out anything. If anybody has questions, we'll get to those. But graduation, the BSN programs, we are graduating more. For the BSN programs, the 2019 pass rates were at 90% for that group. National average was 88.18%. For ADN programs, again, we still are seeing that up from the year before, a little bit lower in the pass rate, but still above 80%. We were at 81 for ADNs, and then 85.96% overall for all RN programs in terms of the graduation. The thing that's a little tricky is, remember that the pass rates are for the calendar year, because that's how those statistics are done with Nclex reporting. And then that the report we get on the numbers is for the academic year. So, and some people have a calendar year for their academic year, some don't. So it's a little bit off in terms of who you're looking at in terms of these particular graduates and the pass rates, but it's just in general to give you an idea about that program. PN, doing really very well. Their graduates were up from last year. Their overall 2019 pass rate was at 93.49%. So really average for the nation was 85.63. So really a very stellar job there with the PN programs. Graduates continue to go up for the APRN programs. We did see a request. I think it was, we have a couple of new APRN programs in Kansas in the last 2 years. I'm not sure we're seeing graduates from those programs yet, but it would have increased admissions, and we'll continue to look to see increased graduates from those programs as well. So on page 80 is one of the, well, I guess that we're still, this is for faculty for all programs. One of the things that we've looked at in the past, and it's in our regs, is that we have faculty that have graduate education. It's kind of grandfathered in how that goes, but as it currently stands. So we look at what our faculty degrees look like, just kind of as an overall picture. You can see that doctorates have gone up. We are seeing an increase there in both our master's and doctorate level, but we also are seeing an increase in baccalaureate level, and that's both at the PN level, that's what's required for faculty, but we are seeing an increase in higher exceptions and degree plans for the RN level. And so we have seen I don't know, I didn't really look at significance in that. Right now, we're just looking at numbers, but we have seen some increase in that, and I have seen an increase in the number of hire exceptions, especially for the clinical adjuncts. And I think that speaks to a lot of what's happening right now with COVID and the need for smaller clinical groups. So there's more people looking at needing adjunct faculty to help make those numbers smaller for their clinical groups. The other thing I put at the bottom, this hasn't been reported, I did for the first time last year, was kind of looking at our percentage of full-time faculty. There are some new studies that are looking at some indicators for programs and how we can look at them to try and determine if there are some warning signs ahead of pass rates going down. And one of the faculty there are several indicators to look at, but one is percentage of full-time faculty, and that's information we already have, so I'm reporting it and looking at, and it looks to be, we are doing really well at 48% over the last 2 years. And the indicators are that if it's above 35%, that programs are showing much higher success when they have a higher percentage of full-time faculty to keep that flow and that, I don't know, there's just more cohesiveness in a group that has full-time faculty kind of guiding things and helping everything hold together well. So I thought that was a good thing to look at and to be able to show you that in Kansas, at least, I know sometimes there are difficulties in finding faculty, but at least in that indicator, the thing about that one that's maybe a little tricky is that if you note at the bottom that faculty could be represented twice. We have a lot of 1+1 programs where faculty may serve in 2 roles, both for PN and ADN. And it's unclear, I'm not sure exactly how to count them because some of them are part-time in one program and part-time in another, but they really are full-time faculty for the school. So there is continuity in that. So right now they're reported as full-time if they're reported full-time by the school. So this is by their by the annual reports and what's being reported by program directors and how their status for their faculty are. Excuse me, just a second. Page 81 looks at attrition. Again, we look at this, want to see how we're doing. Excuse me. Didn't see any statistically significant changes. We were holding pretty steady. We did see a little bit of increase in the academic attrition. I think that was pretty much overall. But again, no statistically significant differences there. Articulation at the bottom, we've been looking at the articulation rates because of our articulation agreements, and that's part of our annual reporting. I'm so sorry, it's dry. It must be dry in here. To make sure we're looking at those that are using the articulation program and how they're doing. We did see a little bit of increase in attrition this year. And I would say, I don't know if we're seeing the effects of COVID with that or if there are other things going on. I don't think we can see a trend yet, but it's something to watch when our rates went from 4% to 20%. But again, the numbers are a little bit smaller for the articulation than they are for the overall programs, but it's something to keep our eye on. COVID may or may not. We've seen, I don't know if programs felt like that was part of it or whether there were just other things that factored into the whole, because COVID didn't really kind of hit until the second part of the year, but it could account for the attrition if some of that, the annual report doesn't really say when it occurs, it's just during the year. So page 82 is actually the additional stats that I put in there. It was kind of a new view from what we've done in the past. And I separated it out by program, and it's really putting the whole thing together for you and looking at what are the number of admissions that program is approved for, how many did they admit, how many did they graduate, what their pass rate was this year, what their percentage of full-time faculty are, and then their attrition rate. And again, the caveat on the attrition rate is that these are based on admits for the current year. And so, you know, in some programs you admit and then you don't see, you're not sure if the attrition happened to those students or not. So I'm just going by kind of a standard way of looking at attrition. I'm trying to look at how others do that. And maybe one of the recommendations might be to look at retention rates as either along with or instead of attrition. I think that's another thing I saw in the studies on programs, is that looking at retention may be a little bit better indicator, but it's just something we had the data for on the attrition and wanted to share that with you as it looks for our programs. And then I looked at the total program, rates overall too, so you can see that. So that's what I have for the data for the annual report. I'd be glad to answer any questions if you have them. Anything on your minds?
I don't hear any questions, Janelle, so thanks for that work on that. That only took you about 10 minutes to put that together, right? Mhm.
Uh-huh.
We appreciate that work.
You're welcome.
I have a motion there to accept anything. That's just the annual report. So we'll go to the next thing, which is a pilot for the new annual format, reporting format. And it has discussion beside it, something we want to talk about today about annual report. So Janelle?
Well, and I apologize, when I put that on the agenda, I wasn't quite sure how to term that, but I think it really is about the question that I see Adrian on, about the annual report. It's a question that's come up before about the current format we're using. We know there need to be some updates and changes to it, but there's a process involved in that. And so there's questions. In the meantime, we've also looked at other things we could be doing to do the annual report. And one of the things that has become available this year is NCSBN, who we've worked with on other things and have done a great job of putting this together. They now have a new template that's out there for an annual report. And they've done a lot of work with that. And I can explain more about that. But I think the idea behind talking about this is that I really apologize. It's just can't quite get the dryness out. It's not COVID, I promise. So there are a couple of issues when we talk about the annual report that to address. And one is the data we collect, and we do that per our annual report. We have some Department of Education regulations that guide that, and because we are an approved approval board for the Department of Education. So there are requirements that we have based that the annual report is based on. So one thing is the data. The second thing is the data template, or how we collect that data. And I think really what I wanted to talk about at this point was that second piece, because one of the things surrounding this is that there also is new data out there, and NCSB put this new template together based on a whole nother pile of research that we could discuss too, about what quality indicators are for a program besides pass rates and what warning signs are. So the core data template that they have put out there is based on that research and that data. Right now we have data requirements that some of them are outside of what that core data is. That doesn't mean we can't still collect that. But thoughts about that could be in using this template, we could be putting ourselves in a place where we would be getting some help with some analysis. They are putting the report out there. They're letting regulatory boards add their own questions, so we can add those that we need if they're not already in there.
Janelle, I'm going to step in here a minute. We talked about a little bit too, that you're right. And you mentioned that the education, Department of Ed has certain regulatory pieces we need to collect, but also our regulations have some stipulations too. Janelle talked about that a little bit. I see Adrian's on the call. Carol volunteered his services today so he could be on just for a little bit. And he's done a lot of work with National Council. If you don't mind, Janelle, I'd like for him to just maybe give us a synapse and kind of some history of that. And so we can add to that with the discussion that we're having here as an introduction to what we might or might not be able to do with our annual report, any kind of changes.
Okay.
Thank you, Madam President. Yes, we've had the existing online education annual report, I believe, since about 2004, 2005. And we set up the system as a way to basically enter in the information. In each year, the programs would be able to fill in their most up-to-date information and not have to basically go back and recreate the wheel every year. And that served us well, but it's really just an electronic version of a paper form. The data that we get as a result of the submissions is somewhat hard to make sense out of. So they're mostly taking the information and using it in PDF form, which doesn't really work well when you're trying to use and do some analysis of statistics and whatnot. But it's the best that we had available to us for the fee that we paid, which was nothing. And so maybe about 7 or so years ago, we kind of started looking at new solutions for the annual report, trying to decide if we wanted to get into a more data-driven system that we could make some sense out of. However, the cost was so high to get those services done, and the process was somewhat complex with the state to get that approved, that we kind of really have delayed it. We had the compact and some other things that came into play during that time. Over the past, I would say maybe a year and a half or two, NTSBN started to look at this from a national perspective, wanting to get national statistics and whatnot so that they could do some analysis of programs across the country. And so they procured a system, Qualtrics, I believe is what it's called, to do some sort of analysis and creation. And I believe they piloted the program with a couple boards. And we looked at it at the time, but the way that our calendar cycles work, we have to give our current vendor a pretty good notice in order for them to make any sort of changes, even the most minimal ones of saying adding or changing a question has to go through a relatively long process. So it's never really hit right for us to determine if we wanted to change. But now that they're moving this program at National Council larger and it's become a bigger initiative, they've expanded some of the custom features that they have available to them that could potentially accommodate what we want to do here in Kansas. And so I guess where we're at right now, as far as I'm kind of concerned, shortly after the first of the year, we have to start the project, whether or not it's with our current vendor or potentially somebody newer if we wanted to go to National Council. Because in order to make it during our timeline, we have to give them at least a 2-month notice so that they can make minimal changes. But if we needed to change our existing system to accommodate any sort of new functionality, potentially we would need even longer than that. And so time is kind of the essence. If we're going to go the National Council way, then we want to start to explore that potential. If we think that we want to maybe continue to think about it for another year, then I also need to know that here relatively soon so that I can start the project with our current vendor and make any sort of changes that are needed on the minimal scale. That's kind of where we're at.
Thanks, Adrian. Do we have some questions there? So is the choice, do we have to make a decision today whether we would go with National Council, or could we make that decision in December and do some more investigation on our part? Or
I think we would have enough time. I apologize. I think we would have enough time. But the December meeting would really need to be the last point in order for us to make the cutoff realistically. I mean, we could try to squeeze it in and push people, but it's sort of hard nowadays to get it done. And so for what we're paying for the existing one, which is nothing, it's lower on the priority maybe than the money-making ones for this organization. For National Council, obviously, they would probably be able to do it a little bit quicker because the system's already set up. The other nice thing about what National Council has is they have the data analysts and the people that can look at the information and make sense of it, the researchers and whatnot. I mean, we do a great job, the best we can, but the data that we get out of the current system is difficult to make any sense of in a realistic manner. And so I think that, you know, both options are available to us, so we could stay the course and go another year, or if hopefully by December, if you could make a decision one way or the other, that would allow us time to do that as well.
And Madam President, I've also done, or Chair, I'm sorry, have done some preliminary work on pros and cons and looking at what our regulations are compared to both systems. So if anyone is interested in that and there's a way to get to the December meeting with some additional information with others' input, if that would be helpful. And certainly I just started to put this together so that the board could understand better what we have, what we are looking at in those directions. So I could utilize what I've got here as a start. If there's interest in providing some input for that for the December meeting.
So any questions from the group? Can I hear some thoughts about what we need to do? You know, my favorite thing is to put a task force or a group together to bring some more information back to the next meeting. That might be an answer if somebody would like to help do that, or some more discussion. Maybe we have some other opinions out there.
This is Britta. I think this is a timely opportunity to take advantage of what's out there, and particularly with the long-term analytics to look at and compare data across states. I think this could be extremely valuable to programs everywhere. So I would be happy to help with that. Being off the education committee, I don't know if you want me, but I would be more than happy to participate.
I would be happy to participate in that. I'm a geek and I really like tech. So I would really enjoy being part of that because it's what I do. I like it.
And we could provide the group, you know, the examples of what the NCSBN one, at least what they have available to them. And we obviously could provide what our screens look like and what the results look like. And you guys can make that decision based on that.
One question I had, Adrian, and I don't know if you can answer it yet or not, is is there what NCSBN uses, would it allow programs to pull data and to like compare us to national or anything?
I think that that's what their objective is to be able to get some useful information out of it. You know, our board week is next week. I'm on their board of directors, so that's certainly a question I can ask next week and have it available to that task force. I'd be happy to do that, but I think that, you know, I don't know if there's going to be like a self-service, if that's what you mean, or if there's maybe going to be some sort of research produced. That I don't know for sure.
Okay.
And I can ask also, Adrian, I've been talking with Nancy Spector at NCSBN because she's kind of spearheading some of that. And I had questions for her, which she was great about answering. I just didn't know all of them. And so that's one I can definitely put out to her as well.
And if you would like, I'm sure if we give them enough notice, we could probably have her available at least for one of those meetings or the task force meeting or even the board meeting. I mean, we'd have to schedule her, but.
Well, I think we kind of have our answer. It sounds like if everybody's in agreement, we might put this group together and let them do some more research to bring some more answers or questions, whatever those are, information back to us so we can make a decision in December for sure. I agree. I think we're headed in the right direction. I just want to make sure that's kind of a big step for us. So I want to make sure everybody's on board. And of course, we would take it to the board. Carol Moreland, can we go ahead and let Bernadette be a part of that task force, even though she's officially off of the...
Yeah, I think that's fine. Yeah. Considering you're going to bring stuff back in December, I mean, that's fine. Yeah.
Okay. So right now, course, Janelle was automatically volunteered, and Christina and Bernadette. Adrian, will you be part of that group also for us?
Yeah, I'd be happy to participate however you would like.
Anybody else have some interest there?
I'd
in
be interested
handling
if you
that?
need someone else.
Okay. Okay, so is the group, do I have any more discussion about that, or can we go ahead and make that decision that we'll let that group bring back more information to the December meeting, and then we can make a decision about whether we move whatever direction we go with the annual report? Is that okay? I don't think we need a motion, do we?
No.
Okay, sounds good. Thanks for the help with that. The next thing I'm going to go to is
Madam
follow-up-
Chair,
Sure.
sorry, I don't mean to interrupt, but I believe there were some motions as far as reapproving the programs after the annual report data. I think we kind of got those, so I believe there are some motions out there.
Yes, for reapproving them for the next year.
Yeah, we have several of them, I see.
Sorry, I kind of just jumped too.
Okay, Chelsea, I'll let you start with those so we can get somebody to make those motions.
Okay. The first one is I move to reapprove the PN programs on full approval status through December 2021.
This is Christina. I'll accept that motion.
Carol Bragdon, I will second.
A motion is second. Any discussion? All in favor say yes.
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 All opposed say no. That motion carries.
And next, I move to reapprove the ADN programs on full approval status through December 2021.
This is Dee Bonenblust, and I so move.
Bernadette, I second.
Motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Motion carries.
I move to reapprove the BSN programs on full approval status through December 2021.
This is Karen. I'll make that motion.
This is Mandy. I will second.
Motion is second. Any other discussion? All in favor say yes.
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 Opposed say no. Motion carries.
And the last one, I move to reapprove the 3 ADN programs, Colby Community College, Donnelly College, and Pratt Community College, and 1 BSN program, Kansas Wesleyan University, on conditional approval status through December 2021.
This is Mandy. I'll make that motion.
And this
This is
Dee.
Carol. I'll second.
Motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Looks like the motion carries. Is that the last one, Chelsea? For now?
Yes.
Okay, thanks Carol Moreland for the help with that. Okay, I'm gonna have the next piece, which is a follow-up from the task force, the IV therapy, as part of the PN core curriculum. Just a little update with the history. We had some questions about PN core curriculum and the IV therapy regulations. A lot of questions, a lot of different interpretations of what it was meant to be, what it wasn't meant to be, what were the intentions, you name it, it was all in that pot. And it just kept getting bigger and bigger. So we put a task force together. And that force, I made myself some notes here, and I put a list of concerns that the Education Task Force was asked to consider around this subject topic. One of them was, what was the expectation of usage for the PN core curriculum for KBOR and Kansas State Board of Nursing? Cost was a consideration for the PN IV therapy. That was another piece. Implementation date for PN core curriculum. What is the expectation of Education Committee / Kansas State Board of Nursing regarding implementation of IV regs? Implementation date for IV regulations to be carried out. Core curriculum requires minor curriculum change and Ivy regulation PN coursework requires the regular curriculum change. Those were all questions that this group tried to answer. And I have some recommendations from this task force of what we came together with. The members of the task force were Carol Moreland, Christina Rudisil, myself, Linda Davies, Janelle Martin, and did I leave anybody out? That was on the group. So the first meeting I had is I met myself to Kansas Board of Regents and asked some questions and asked some people to meet with me so I could get an idea of what Kansas Board of Regents expectations were for IV therapy regulations and also for their core curriculum for PN, what they expected from the schools. And after visiting with them for about an hour, it was decided that maybe I should bring them to the task force instead of me just reporting that, bring it to the task force, and we could ask more questions around some of those findings in that. And that proved to be very valuable. They're great people that all they want to do is help. And so it was great conversations. We discovered a few other things along the way. So brought the task force in with Kansas Board of Regents, and then we had a third session where the task force just met to clean up and make the recommendation list that I'm going to read you here in a minute of what our decisions were after we heard the pieces from Kansas Board of Regents. After I go through this, if you have some questions, I would be glad to answer that, or the task force can help with that. I have 7 recommendations here that I will go through. Clarification with the Kansas Board of Regents, recommendations for PN standalone programs to use the core curriculum, but no mandate. We had some conversation around that ones were mandated or had to use it. Kansas Board of Regents did not say that. They said they highly suggest that, but they don't stipulate or say who has to use it. PN core curriculum was purposely aligned to help schools achieve rigor, but also tiered and non-tiered courses so the schools will be eligible for Perkins grant funds. It's one of the big things. It's already done. If you work in that arena, you have to understand that the guidelines that are set for tiered and non-tiered are a little tricky sometimes if you're writing your own curriculum from the very start to be in the right percentages so that you are eligible for the Perkins grant money. I work in a community college, and it is very valuable for our program to be eligible for that because that helps us do a lot of things in our school I would never be able to do, from professional development to any kind of equipment in my lab. Perkins grant money helps me do that. And so it's important that I stay with that. Recommendation from the task force will be that Kansas State Board of Nursing will remain neutral with this choice for P and core to be individual school's choice. Kansas Board of Regents said if the board wanted to make other recommendations and hold the schools to a different level of accountability, they were okay with that and they would follow that, but it wasn't their intent. So that was the recommendation we had from the task force. The next one, Kansas Board of Regents mentioned that we talked about the financing part of this, and they mentioned that if a school absolutely could not afford the added curriculum expense with the IV therapy, that they might check with KBOR and see if there was some kind of grant opportunities maybe to be able to help fund them through that. I don't know if you've talked to Connie Bean or ever been exposed. She's the person who does most of the grant delivery, and she could hardly wait till I got done speaking, and she was hurriedly unmuting her phone so she could say, we want to help schools with the grant opportunities if they're not able to fund themselves to be able to produce that IV therapy. And her reasoning was the same as our task force had, and that was we wanted these students when they came out of our PN schools to be able to be employable, and we need to recognize that they need to be able to get jobs. A lot of them are headed to RN, but some aren't, and industry needs them to be IV certified now and be able to do that work to their scope of practice. The third recommendation was Kansas Board of Regents offered to extend the date for implementation of the PN core curriculum to the date of fall of 2021. That was to help give some schools some time to adopt the curriculum and complete the paperwork for KSBN approval. Recommendations from the task force was to accept this extension date for core to fall of 2021. Some of the squeeze that was here, the push was, we were supposed to be implementing that fall of 2020, which we are now in, and the schools were struggling trying to get that going. And so we were getting some requests to just sprinkle it in or put it at the last of the curriculum piece of their program. And so with extending this date here, the school will be able to get that in line where it needs to be able to give the correct documentation, submit it to Janelle to this committee. So we could give them a chance to actually think about it and put those pieces where they needed to be successful for those students and for their program. The next one was a recommendation for the task force was that the IV therapy be a part of every PN program in Kansas that offers PN certificate for LPN licensure. A lot of discussion around this, and we had this with Kansas Board of Regents also, about the fact that we didn't have some that were, some that weren't. We could count on the fact that this state, Kansas, if you went through a PN certificate program that was approved, that you would have the ability to do IV work in an institution, and you were certified to be able to do that, and you wouldn't have to check which school you were at, or if you did, or if you didn't. We would still need to do some reporting for the agency to be able to put that on with their licensure, so every institution would know that. But this task force looked at it and said, we think every school, every PN program should implement this. So that was one of the recommendations. Another one, implementation date recommendation to be fall of 2021. That was for the IV. Nobody can do that, turn that on a dime. So the expectation would be PN core curriculum. If you're going to use that, that would be implemented. Kansas Board of Regents said we could do that 2021. And the recommendations for the IV therapy to be implemented at the same time, whether you had core or not, for every program. Recommendation for the task force is that the PN core curriculum change would remain a minor curriculum change request, and that the recommendation for the task force is that the IV therapy course content would remain a major curriculum change. And in visiting with Janelle a little bit, one of the things that is tough is that the schools, when they put in those recommendations, they need to be very specific about where those objectives are and how they're going to handle those, instead of just listing them and naming them as came from the regulations. We need to know how you're going to handle that and what you're going to do. So that's part of this regulatory committee's job, is to make sure those things are in alignment. So that's what I had on my list here of recommendations for the task force. Any questions for myself or the group? Okay. So Carol Moreland, I'm going to lean on you again. Do we need to make a motion and accept these recommendations?
Yes, you would need to. And I don't know that we have one made up, do we, Chelsea? Yeah, I didn't think so, but yeah.
Okay, so could someone make the motion that would accept these as stated or recommended in my report, and I can get those to Chelsea?
This is Carol Bragdon. I will so move that the committee accept the task force report on IV therapy programs for PN schools, as Patricia has stated, and that we accept that. Thank you.
Okay. And this is Dee Bonenbless, and I will second that motion.
So motion and a second. Any discussion?
Patsy, I think that your notes are spot on. The only thing I just thought of is the question we had at the last board meeting of if a student, and Bernadette asked it of me as well, if a student doesn't pass the IV therapy portion, do they still pass the class? And that was something that we discussed in our group as well, and said that our recommendation is that it is all inclusive.
Thanks for that clarification. Any other questions? Okay, but motion is second and no other discussion. So all in favor say yes.
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 All opposed say no. Looks like the motion carries. Thanks for the opportunity to do that. whenever I volunteer for one of those things, I always think, oh man, another responsibility. But when I get into it, I learn tons of things. I've been doing this for a while, and every time I do that, I learn something else. So it's worth the effort if you ever hesitate to volunteer for a group. Yeah, I think I get more out of it than I certainly give. So the next thing we have is scholarships. Janelle, you want to talk about that just a little bit?
Great. As you know, Arthur Davis has been very gracious in offering funds to allow us to do 4 nursing scholarships. And they have affirmed that they will do it again for this year, for 2020. So what I wanted to bring forward was to look at the topic for the scholarship essay. In the past, just to remind you, in 2018, 2019, the topic was, what does professionalism mean to you? In 16 and 17, we did impact of technology on nursing for the essay topic. And then 3 years prior to that was unique contributions of nursing to healthcare. So the question kind of on the table is, do you want to continue with the topic that you have, or do you want to make a change to that essay topic for this year? And if so, if there are ideas, I have some potentials, but I think you all too probably have some ideas about that as well.
So the timeline with this, just to put the history here again, is we had done those in several years past. We did them and presented those in December. That seemed to be a timeline issue for us. So we changed it this last year, and we collected those, and we had to review those by the end of January, and then our plan was to award those in the March meeting. We didn't have the March meeting, so we did that virtually, but so that's kind of the timeline. So any discussion about a topic?
We could do something about a pandemic.
I
There you
agree.
go.
I was going to say, I think that it should be something about the pandemic because it's definitely affected those going into nursing.
So what angle
I
with
think
that with
that's
the pandemic? Bernadette, I see you unmuted your phone. Do you have an idea?
Yeah, just something, how has, because everybody's watching this pandemic, students, prospective students, patients, and how has it changed the face of nursing? I think that would be interesting to see their perceptions.
I love that idea.
That's
I think
great.
how to change the face. Yeah, I think that's perfect.
I agree with that. That is perfect.
So how has a pandemic changed the face of nursing?
Yeah, I think that's pretty right on, all the way from bricks and mortar schools to, right?
Be interesting their angle on it.
Any other suggestions? Do we need a motion, or are we okay with just, I think we've got an idea. We'll just go ahead. How many scholarships were they? They were $1,000 a piece. Were there 5 of them?
They're actually 4, 2 PN, 2 RN. And what I will do is ask for some volunteers. Last year we had 4 to review all of the essays, and then everybody does their own scoring on it. And then I would do the final, put everybody's together to get our top 4 candidates. This would go out fairly quickly. We asked for those scholarships to be back, or to be everything to be turned in by November 30th. And then, so we would be looking for you all to be doing review during December and January, and hopefully then have that all done. And so we can identify and let the winners know so that they can be available for the March meeting. Even if it's by Zoom this time, we can maybe have them on board with us for that part.
Janelle, I'm happy to help with those reviews if you need.
Great.
And I'm happy to do it again as well.
Thank you, Mandy.
Janelle, I would like to be a part of that process too, please.
Great, thank you.
Carol, you're muted.
I got to get unmuted here, sorry. Just as a reminder, there can't be anybody, how this has been in the past is no one associated with a nursing program can review them, just to be fair and as unbiased as possible. You don't know the names or anything when they're sent to you. They're just numbered. But we've always in the past, if you choose to continue this way, is that none of the reviewers can be associated with a nursing program. Just a question for you, whatever you want to do.
Carol, just a question. If it's someone who is primarily graduate faculty, does it matter? Or is it just anybody associated with a program?
In the past, it was no one associated with the program, but again, it's the choice of the committee, what you wanted to do. I just wanted to bring that up in case you wanted to have any discussion
Yeah,
about
that's
that.
a good point.
Sounds like you've already got some help there, so I think we're on the right track. Any other
Great.
discussion about this issue? Okay, Janelle, we'll let you do your magic.
Thank you. Appreciate it.
I want to just stop here a minute and thank everyone for the work that they had on this task force. I kind of said I learned more, but it is an extra effort to do that. I appreciate that help. It helps this meeting move along very quickly. And that is great for all of us and even the people watching. Time is very valuable to us, and I appreciate the extra effort on the side because it is you have to be committed or it just doesn't work. And I appreciate the commitment of this team. So we're going to go to unfinished business, virtual site visits, a guideline recommendation. Janelle, you want to introduce that and your team that worked on that?
Great. So last meeting, we did bring up the possibility because of what happened with COVID and our canceled visits and the ability to continue to work on site visits and somehow do that. We know some states have done that virtually. So brought some ideas for a guideline, and it was decided that we really wanted some more input. And so the task force that got together, Bernadette Federoff, Dee Bonenblest, and Karen Kidder and myself, met over this. So we took the original kind of draft that I had put together and kind of hashed out some questions about language. And again, a reminder that this was part of the guidelines for survey visits that are already out there. This is just a way to, or I shouldn't say just, it was a way to introduce how we could possibly continue with site visits if for some reason we could not do on-site. The guidelines do say that on-site is planned. And then if for whatever reason the school is under some kind of restriction because of where they are with COVID or whether it's because of KSBN if there's something from our side that prevents that we would have a way to possibly do a virtual site visit. And so I looked at I had looked at a couple of the programs. There's only a couple of states right now that I think there's 3 actually that are doing virtual site visits. And so brought some of that information to it with the task force. And so the recommendation is in front of you. It's kind of embedded in the rest of the site report, but on the first page, second paragraph is where kind of it includes the virtual visit. And then I think again on page 7 and 8 are where it kind of adds in the virtual site visit, virtual survey visit, and how that would look and how that might look different compared to an on-site. So those were the recommendations that came forward and out of that. And basically that like I said, that the recommendation was continue to kind of put forth that the on-site visit is what we would plan for, with the virtual being a backup if there were some issue that came up. It does say in there at the discretion of the education compliance officer, who is always accountable to her committees and her board for anything that would come up that was, I think there are some things that are fairly straightforward, but whether something were done virtually or whether it were postponed might be something that aren't in the guidelines to talk about. But the idea was that an on-site initial visit should always be on-site. So we would have to figure out a way to at least do an on-site visit, whether the rest of the guidelines kind of leave it open to being able to do partially one way, with the idea that there might be a pending approval until an on-site visit could be done. And an initial or a focus visit, I think that was what we decided was important, that there were places that we definitely needed to get on site based on the information and the reason we were doing the on-site visit and per our current regulations. The initial visit, there's an on-site, on-ground visit that's in our reg. The others are a little bit more open to interpretation in terms of whether an on-site is mandatory or a follow-up visit is there, but whether it's on-ground, on-site is a little more open to interpretation. So that was the recommendation, and this is what came out of that. It really doesn't look a lot different, other than there's a lot more Zoom interaction. We still want interactive, so it's not just a call with them. We want to be able to talk with them and talk with all the different groups that we currently do. The difference would be whether we do part of it virtually and do an on-site, or whether there could be also the possibility of one on-site visitor, one virtual visitor, site visitor with the group. We almost had to do that for Donnelly, but it worked well. We had it set up to where we could have done it with one of the site visitors virtually. But again, that's going to be, each site is going to be, depends on what their technology, with what they're having to do with programs right now anyway. I think it's going to be less of an issue to do that kind of interaction. But so this is
tell me who was on the team. Tell me who was on the team again.
Bernadette Federoff, Dee Bonenblest, Karen Kidder, and myself.
Okay, so this recommendation that you have is as you saw in your paper, a draft. I too had some question about two things that really were important to me. One was in the first paragraph there on the first page and 85 of the packet, was that the nursing program administrator may request that the site visit and the accreditation survey be done as a joint survey. May meaning I still have the option to do it separate, which is totally my preference. So I wanted to, that was important to me to have that in there. The other piece was, yes, the discretion of the education compliance officer. For me, I didn't really feel like that was a one-person decision if we needed to decide that. So I realize these are guidelines to set up. Any other discussion, or can I hear from the rest of the group? Was there some discussion other than that of something else we still need to work on, or how do you feel about this guidelines?
This is Dee Bonenblest, and I have a question for those of you that have completed site visits for the, board, the state board. How, after looking at these guidelines, would you feel comfortable with doing that? Or I would just like to hear from some of you who have actually completed that site visit and how that would look in this capacity.
This is Bernadette, and I think a lot of the things that are listed here could be done virtually, and you could check that. I think there was a lot of discussion between the people in the group about anything that, sometimes you get a report that looks really good and you get there and there are all sorts of issues. And sometimes the report doesn't look very good and you get there and it's fine once you clarify. I think leaving that open caveat, if the surveyors feel uncomfortable with what they're seeing or hearing, there's always that option to have the on-site visit. And I think that has to be left there because you never know what you're going to find exactly. But I think a lot of it, Dee, could be. There may be constraints like, Janelle was talking about people who are able to do clinical visits and they were doing it by video or, cameras. That may not be possible in all facilities if the facility restricts that. So then maybe there's a follow-up with that. But I think this is detailed enough but loose enough to let us make some decisions based on what we find.
I would agree with Bernadette. And I think that for me, one of the things that keeps ringing is when we are having to, like Janelle and I have split duties to where she would go into HR and start going through the faculty files. And, so if the HR was not capable or did not have the capabilities of, submitting the needed information electronically or what have you, especially when you think about transcripts alone, not everybody has the electronic transcripts, so I think, that may be an issue in the clinical site visits, obviously, but there's also something to be said for body language. You know, sometimes body language is missed in virtual worlds. You know, but I think overall, I think it's a good plan for if we need to, but I would strongly, if we are able to do on site. But I think it's a good plan overall.
And I would certainly be open, you know, we had talked about the language here, Patsy, and if others, about the discretion. If that needs to include site visitors, so it's because the site visitors are you all. If that language, if there's something that would make that more comfortable, I am very open to that as well.
So some discussion that I have had with Carol Moreland, I talked a little bit with her about how we handle this next fall. You know, this group might be ready to decide right now. We could go ahead and move into this guideline and accept it, and we could make a motion and do that. We could do that. Or our option might be that we just here have some discussion about making the visits virtual for fall till December. And then at that point, we make another decision for the next move. We could not have any visits this fall because of the question that's going on. Virtual visits are not that easy. It takes a little bit of work. I'm talking, and I haven't done one, but I understand, Dee, you're working on some stuff with they said, and it's a lot of work and a lot of expense and a lot of pieces you have to put together to do that. We thought face-to-face visits were a lot of work. I think the virtual puts another twist to that. So I just need to hear from the group kind of what you think. Some of the suggestions were we could just right now with this group say we want to do everything virtual this fall for now, or we could accept the guidelines that are here with some changes and a little bit in the verbiage. We could have more discussion, more meeting on it. What's the flavor of the group here?
This is Carol Bragdon. One of my concerns, I guess, is we don't know what fall is going to look like at this point. We may be kind of where we are right now, which means we probably could do some on-site kinds of things. But if Kansas turns quite red and we have this horrid mix of flu and COVID, I don't think that we should put anybody at risk and send visitors out, or that the schools are really going to have the capability and resources available to create all of that Zoom kind of thing. I think it's going to be just difficult to know what the right thing to do is. And I guess I'm saying maybe we should prioritize, you know, if there are some visits that Carol and Janelle feel absolutely need to be made this fall, that we then, you know, see what would be best for the school and for us, and then maybe defer things later in the year if at all possible for those schools that we know are functioning well and likely not to have any big issues.
Carol Moreland, you're on mute.
I feel like I'm in school, but I just raised my hand.
Yeah, I see that. I see that.
I guess have a couple of comments, and again, it's the committee's decision, but I ultimately feel responsible for the safety when people go out, and the safety of my staff, the safety of the site visitors. You know, in Kansas, it's very difficult because every county has their own now. And so you really, it's not just a statewide, and it's easy to say, yeah, there's no travel, but you know, to keep up on what every county has may be a little bit difficult, but may be able to be done, and the school could probably provide some of that information. The other thing you know to remember on the virtual visits, if they're submitting information to us, if it's going to be sensitive information, we may have to do something different as far as receiving that electronic in the agency. That's why we do not have some things in the agency electronic, because of the sensitive information and how it's submitted. We have to be able to protect that information when it comes into the agency. So that may be something that I don't know, I see Adrian's on, so maybe he has something to say about that, but I just want to make sure that we're able to do that from the agency.
And I've not done many site visits, so I don't know exactly what's gathered all the time. If it's like FERPA information for schools or HIPAA information or student information, PII, that sort of thing, we're required to protect that in a certain manner. And via email is not considered generally a secured method by doing that, unless you do it in a very certain way, which is difficult to control. So we would need to come up with some sort of a method for them to upload data and provide that to you, whether or not it's through our submission service that we have. But I need to know a little bit more details, what that might be, so that we could work through it and ensure that we're compliant with the requirements.
I think at this point, and I don't, correct me from what I've done, it would be student files and faculty files. And I think one of the things that one of the other states had done is, and I don't know how they thought it had worked okay too, but to get on a one-on-one Zoom call with someone who's with the faculty files or student files, to be able to, I don't know how well you can read when you do things like to be able to provide where it's interaction and it can be seen and documented that it's in the file versus having them scan or have a way to do it electronically. Both are being done. But again, because of ASIN and CCNE and some of the virtual they've done, I think, but it can be expensive and cumbersome for them too, as well as a security. But those are the two things I can think of off the top that we don't currently get ahead of time, because we do that review on site.
So I was going to say, when it comes to each county, CMS has weekly, they send out, you can go by state and go in by county and see their positivity rate. I have to do it every week. So I know every week what not only my county, but the surrounding counties that I have to monitor, if they're a high, medium, or low, and you can even see the positivity rate in numbers as well. So if a actual on-site visit is warranted, you could always have that school check it, or you could check it and see where they're at and decide what you can and can't do. I know it doesn't tell you too much in advance, but it does have, now we're at 3 weeks, I believe, my third week I'm looking. So they have back, the back 3 weeks, so you can see the trend, and that may help you to decide what you can and can't do on site, what you have to do. So, and sending people out.
Yeah, I think one of the other things to factor in here, I'm looking at 1, 2, 3, 4, 5, 6 site visits this fall. And of those 6, 4 of them are focused visits. So one is a reapproval, one is a follow-up after first graduation, which we could push out another quarter if we need to. One of the things is to look at the impact as we go forward. I know it's going to start rolling downhill too at some point. But again, if we're looking at somebody who's already on and we haven't had any complaints, statistics that show us there are any issues, that maybe those are the ones that virtually would be fine to do. So those are just a couple of more facts for you as you look at the schedule for this fall, and we actually have one scheduled in 2 weeks. So this is good to discuss now.
Okay, so it sounds like, so I'll try to sum up what we're doing here. We have several choices. One is we could try to work out something and do all the ones that are on the schedule virtually. If that's what we want to do, we could try to prioritize those as was suggested about the ones that we need to do this fall and only do those. We also have the draft that we have about making a decision one way or the other of how we do that and start with those guidelines. So what else do we think we need to do here?
I think that the guidelines are really probably are where we need to go. And even for this, I think some of these visits, if we can do them, do we really need to physically talk to everybody that we need to, if we could even go and be in one private area there and be secluded from some of those folks, because all the nursing students obviously are at clinical, so it's a increased risk to physically see them in person. So could we not do kind of a combination? And I think it's up to the discretion of the team and the school if they can handle doing that.
That seemed to work really well when you guys did Donnelly. I mean, I know that that was both on-site and virtual.
Our
So.
student visit was all Zoom. We had all the, I guess we had 2 students in person in a room, socially distanced with masks. And then everybody else was on the Zoom call. And at least we had a couple that weren't on Zoom, but it's nice to have that as an expectation, because then you are visually seeing them, talking with them, at least seeing some expression and interaction versus not having idea what they're doing on a phone. But we also did that with some of the faculty and support. We usually had at least one person in the room with us, but we might have others that were on Zoom as well. Advisory was by Zoom, and it seemed to work well for them because they didn't have to be someplace in a special place, and they could, but they were all involved in communicating with us. I mean, there were maybe a couple that weren't, but that happens when they're in person as well. So we felt like it worked extremely well there. They were well set up to do it and very helpful. It's a smaller program, so that I don't know if that has anything to do with it, but it just, to give you an idea, it did seem to work well.
Even the tour, Patty was prepared with her little iPad to, walk around with the video on. And you know what, in some cases that may be just a great idea.
Would you like a motion then, Patsy?
What's that?
Are you needing a motion then?
Yeah, so we have a visit coming up in 2 weeks, so we kind of need to know where we're headed with this. And honoring Carol Moreland's responsibility and her request about keeping everybody safe. That goes with us too. Some of us are not 20 anymore, and so to travel across the state, which I've not done because of other restrictions, I would have a hard time doing that. I mean, I'm working partly from home, also minimizing the exposure I have to that whole group too. So in consideration for those of us that are going to be doing those visits, I don't want anybody to be put in a place that they're not comfortable. So I guess we are ready for a motion. We do have one printed. You want to read that one, Chelsea, and then if that doesn't fit, we'll adjust it.
Sure. I move to approve the updated site visit guidelines that include new guidance on virtual site visits for nursing programs.
I would accept that motion. This is Christina.
And I would second. It really gives us a lot of discretion, and I like that.
Okay, so I have a motion and a second. Is there any other discussion?
This is Carol Bragdon. I don't know if it's clear enough in the report for the flexibility. We may want to just add that decisions regarding the method for site visits be deemed or arranged through the collaboration between the education specialist, compliance officer, the team members, and the KSBN executive officer pertinent to immediate concerns at the time of the visit, or something to those words, where it's very clear that it's adaptable and we may have to make a change a week ahead of time to make sure that our mandates for safety for everyone are adequately addressed to everyone's satisfaction.
And consistency, that's the biggest thing with this, is that we're consistent with the schools and not doing, have a decision-making tree, and so several people can own that decision. I agree with that. Christina, are you willing to?
And probably ought to add the program, administrator in the end with that piece. It's really the team, the executive director for the agency, and the school.
Do you get that, Chelsea, for that amendment?
Yes, so if I may read it, just to be sure that it's clear. I move to approve the updated site visit guidelines that include new guidance on virtual site visits for nursing programs, adding that determinations for the methods of the site visits are up to the discretion of the Educational Compliance Officer, the KSBN Executive Officer, program administrators, and team members pertinent to immediate concerns at the time of the visit.
That's great.
I accept that amendment.
And I second.
It's a motion is made in the second. Any other discussion? All in favor say yes.
Yes.
All opposed say no. Looks like the motion carries. Chelsea, you made us look really good when you read that. So you did good. I'm supposed to keep track of the time. We've been at this for a couple hours. Do we need a break to finish the rest of the agenda for about 10 minutes and come back and we can just clean this up? Okay, let's do that. 10 minutes. What is it? So 10:50. Let's meet back at 10:50. That's a little more. 15. Okay.
Thanks.
Just leave your Zoom on and we'll just come back.
I'm still in the board meeting.
Okay, I guess it's 10:50. Colton, are we ready to go? Okay. We're going to go ahead and resume and continue with unfinished business. 2020 and 2021 nursing and MHT program site visit schedules.
I think I might need to clarify. I don't know, your packets, it looks like you may have gotten 2020 twice. Or did you get 2021?
I have 20 and also 2021.
Okay, good. For some reason, when I printed out that part, I don't know whether I did that or not. So just a couple things to let you know. On the current schedule that right now, like I said, Kansas Wesleyan is scheduled for next week. I think one of the questions with the motion that we just had, it sounds like that the decision to go on site is that going to be, we kind of need to do how far ahead of time are the recommendations for how far ahead of time if we're planning to do an on-site, that we look at conditions and we talk with the program administrator to make sure everything's still good, or is there, I'm kind of thinking through that process now as we go through, and we can be looking at how things are going in that area. If a school has an outbreak, I think that would be a good reason to, but I just wanted to kind of double check on that, because right now I have, like I said, everybody's scheduled. Colby visit was rescheduled to October 13th and 14th, not the 6th and 7th. And Labette is supposed to be November 4th and 5th. I got those dates wrong. But other than that.
Is Kansas Wesleyan still scheduled for next week?
Yes, 23rd, 24th. And Becky Sander is scheduled to go with me. We've been in contact with Kansas Wesleyan. Janine there we've been doing updates on their plans and how we're meeting and where we're meeting and social distancing and masks and all of that. So we've made adjustments to account for that, and felt so far like that's going to work okay. I think it kind of comes down to what I'm hearing is I want to be respectful of the other site visitors, and for myself, you know, I'm working from home too, so keeping my distance and staying safe as well. So I guess that's just a question of, you know, at some point, does there need to be a, you know, a decision point, you know, that says, okay, it's going to be on site. We'll check in 2 weeks before, a week before. We need to know from the administrator if there's anything that happens on, you know, for their school that would complicate things like an outbreak or something among staff or faculty, so that we could make a decision whether it happens, it either gets delayed or switched to virtual. So those are still kind of, as I was thinking through that as well, whether there's a recommendation on for how I want to handle it.
Janelle, it sounds like if something were to happen on the 22nd, I think probably you would have to switch to virtual mode and not go. I don't think it would be fair to anybody to do it the opposite way, that, you know, we say we're going to be virtual. Well, we're just kidding. We're showing up tomorrow.
Right.
I don't think that is appropriate to do, but I mean, ideally you're not going to change plans, but if something happens, I think you need to have that opportunity.
So, and that's one of the things I've been doing. I've been checking in with Janine. She's been actually checking in with me pretty much weekly to make sure we're still on, that nothing's changed for us, nothing's changed for them. And
So
I continue to do that.
is the summary of the guidelines that we would do them in person unless there was something that was causing us a problem or a concern that we would want to do it virtual. Is that where we're leaving this? Is that what the guidelines are pretty much? I mean, that's the way I read them.
Right, with it and the input from the program administrator, what's happening in their end, because to Carol's point, things could be different by county, by place that we're going. So I think it's always a good idea to stay in contact, depending on what part of the state we're going to and where we're headed. Like
Or Yeah, or for that matter, if somebody on the panel tests positive, but we're not symptomatic, it's, you know, we need to protect the school as well.
Exactly.
So, I mean, I don't know. I think I would leave that at the discretion of whoever's attending the school and Carol, you know, and the program administrator on, you know, if it needs to change. I agree with, you know, if we say we're going to be on site and we have to switch to virtual, that's one thing. But if we say we're going to be virtual and all of a sudden, bang, hi, we're here, you know, that's a whole, you know, I don't agree with that, as has been mentioned. But, you know, I think we also need to consider, you know, we need to allow that grace for technology adjustments and things of that nature if we are going from on-site to virtual, and maybe we
Right.
weren't quite prepared for virtual. So especially, you know, with Kansas Wesleyan specifically, you know, we've been planning on site this whole time, and, you know, Monday we say, oh, sorry, you know, we need to switch to virtual for whatever reason. There needs to be an allotment of grace, I think.
Right. I would agree with that.
So your original question was that what's the kind of timeline we start with right now? You need to tell them
Yeah.
out or 1 week out. You have to make some decision somewhere. Can't keep waiting to make the decision. So is that the guidance you're wanting from us?
Right. I think that that makes sense to me.
Well, if I'm the program administrator, I want to know as soon as you have an idea what you're going to do. I don't care if it's the correct one or not. I just need to know, because some of those wheels turn pretty slowly. And if you haven't done a bunch of virtual, you're going to struggle with getting all those pieces, but at least I would.
Yeah.
He's very willing to help. They want to help with the accreditation and approval process, but those wheels just turn kind of slow sometimes. So
And that's what I've tried to do for those that are this fall, but especially the ones that were rescheduled from the spring. We put out there, we're planning to do on-site unless something changes, and we will just try to keep that communication open, which I think we have for the first 2 visits. The other ones are still to come, and I'm still talking with them about, because I've had some come back to me and say, so are we going to switch to virtual? And my comment has been, for now, we're planning on site unless something changes. And so with this guidance too, it just leaves it more open for that conversation and I do think the grace to switch to a virtual, a lot of them had to switch to virtual for classrooms, so they have some capability, but to get everybody on board does take a little adjustment, so we could allow for that.
So what kind of reference or guideline does the group want to give for the guidelines? Are we talking about, I mean, are we pretty good with 2 weeks, making some call within 2 weeks of the visit? I mean, what does the group think?
I think you have to have the opportunity to make a last minute decision if something were to happen. I mean, if Janelle were to become symptomatic, you know, one of us could go, but clearly she wouldn't do that. And that could happen as late as the day or day of.
My suggestion is we just assume that everything is going to be on site unless we notify you otherwise, you know, and allow that discretion. I mean, I think as long as, you know, the administrator, we're always in contact with the administrator up to the visit anyway, even that morning sometimes if there's had to be a change. But, you know, so I think just as long as the administrator knows, hey, we understand that things may change suddenly and we will, you know, be considerate of that the best we can, but just that it will be on site unless something changes.
And to also make sure they understand if something changes that's significant on their part, we need to know too, so that
Yes. Yeah, because we don't always have control over that.
That's the conversation I've had with Kansas Wesleyan up to this point. So
yeah, I guess my concern is if we say, you know, you'll know within 2 weeks or 1 week, well, the day of, if something, I mean, it just, I mean, the world we live in today, we always make plans and then they fall through.
So I think that helps. I think that helps me. I just wanted to kind of get that, you know, I can always talk with Carol and the administrator in the loop if there needs to be a change. It doesn't have to be a specific date, but we would, again, I think the idea, what I've been telling them is we are assuming on site unless we have something that outside factor that changes that for us.
So I think what we're saying is we're piloting these new guidelines and we're going to find our way through that. So December, let's put it back on the agenda. And if we need to adjust some things, we would. But
Okay.
I understand last minute things. just the more, if we can make a decision, if we know it's really bad there and we're going to have to do virtual, if we already know that 2 weeks ahead of time, there's no reason not to make that switch and let them know. So
Exactly.
we're on a piloting. Sounds good. Okay, anything else about the site visits and the schedules that we've got here?
Yeah, I think the schedule's pretty set for fall, spring. I'm gonna be calling on some folks to fill in spots as needed, but I think for right now, we're good.
Okay, so let's move on to the next piece agenda. And that is about the petitions for test and retest.
And we have 7 folks on that list. I think Chelsea has the motion for that. These are all the ones that met the requirements.
Chelsea, I guess you can go ahead. You're going to say all those names so I know how to say them on the board.
I will try my best.
Okay.
All we can do.
I move to approve the petition for permission to test retest summary from May 9th, 2020 through August 14th, 2020, which includes Gertrude Amisa, Kylie Engel, Yvonne Kenyria, Martha Kamuri Price, Tina Asper Reeves, Bailey Weilert, and Derek Wilson.
This is Christina Rudisil. I'll accept that motion.
Karen, I'll second.
A motion is second. Any other discussion? Then everyone that is in favor of that motion, please say yes.
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 If you're opposed, say no. Any abstentions? Looks like the motion carries. Okay. Agenda for December 2020. NCSBN Nursing Education Approval Guidelines.
Yeah, and I think we can discuss that in concert with what we're going to be looking at for the annual report. I think those things can.
Okay. So that's going to be on the agenda, and workforce survey data. That probably falls in that category too.
Yeah, I think we had decided at last meeting that that was something that needed to go to the full board. It got kind of moved to the agenda. I'm not sure. I think I might have left it there. It's really a placeholder. I think it's going to go to the full board. It may be something that comes back around, but we may or may not need to leave it there for right now until something more is decided at the full board level. If there's anything I want to add to that.
I know Bernadette, I think you had brought that to the group at the beginning. Can you remind us so we can write it down for the full board what the intention of that request was?
I think this stems from some conversation that occurred in the last 2 years, over the last 2 years, about Kansas needing to really be able to identify our workforce, what's in the pipeline, what's out there, where it's at, how long it's going to be there, what sort of variety of workforce do we have. And Adrian had indicated that National Council already had captured some of the questions we thought might be important to have, and so that we might not have to reinvent the wheel. I think the fact that this could go to the full board probably is more appropriate. It's not just an education issue, it is a workforce issue. So perhaps that's where it belongs, but I think that, you know, we'd really like to see this move along so we can begin to gather some of that data and use it.
So we have it, probably we'll not put it on our agenda, but we'd put it on the agenda for the full board. That would, yes, we'd make. Okay, that's what we're going to do. Anything else?
No.
Okay, I think we're making a list for agenda for December.
And Patsy, I also have to put the annual report task force, so whatever that comes back as, whatever recommendation or information that the task force has for that. And then to also put the site visit guidelines, the draft guidelines, and kind of an update on the pilot after this session of visits.
Okay, anything else we need to follow up with that? that we have today that we need to put on the agenda for December?
The plan is for December to be a Zoom meeting as well.
Well, that is a consideration we need to talk about. I think the board will decide tomorrow what they're going to do. Do we need to have a discussion about that? The other entities I see are around, I think Adrian had spoke to National Council. They're still shut down all of travel or any kind of face-to-face through the end of the year for sure. Is that correct, Adrian? You on? I can't hear you.
He's
He
not.
nodded.
I think he had to go to the investigative.
No,
didn't
he's
he?
there.
Okay.
He's nodding.
Yes, that's
Yes.
correct. Sorry.
Okay, that's correct. Well, that's what I'm hearing from some other agencies. So does the group have a different opinion, or are we okay with trying to do this again in December for now?
I'm okay with doing Zoom. The rate I'm going, I can't travel too far from work right now anyway. And the way it sounds, fall and winter might be a little hectic.
Yeah, a little bit.
Mhm.
Even though we're social butterflies and we'd like to be together and whatever, I don't think we're going to be able to do that for a little bit. So if there's not a opposition to that, that's probably what this committee would plan on doing, if you're okay with that.
Great idea.
Okay. And then the board
Excellent.
will decide tomorrow what they're going to do for the rest of this year. Okay, anything else? We've got a list for the agenda. Okay, I guess, Chelsea, we need one more motion for adjournment.
I'm sorry, Patsy, I did have a question I forgot to bring to the group that was from KCP&E yesterday.
Okay.
They want to know if the board is going to continue to be giving us a lot of grace in regards to our clinicals for this academic year. And I don't know if that's something more for the board or for us, but it's worthy of a conversation perhaps.
I'm going to put Carol Moreland on the spot a little bit about kind of some discussion we've had around that. And substantive change is what accreditation calls it, but anything that you're going to make permanent or what we're doing temporarily. If you just speak to that a little bit, Carol, for me.
Well, I think what we've done in the past and what we've kind of said, when this started in March is like Patsy said, if this is just a temporary change, just let us know, like send a letter, send some communication or something. But again, if you could just designate that it's just going to be for this semester, or it's going to be until you can find another clinical site, or whatever be the case. But if it's truly something that you're wanting to do permanent change, then it probably would be a curriculum change, That's how we've done it in the past. I mean, what we were kind of told from the board, and Patsy and Carol can kind of chime in, Mandy can kind of chime in here, is the board wants to work with the programs as much as possible. They understand that it's a very difficult time and they're truly trying to do the very best that they can. However, it's very helpful if we as an agency are able to kind of keep up with the changes too, in case there's any questions that come to us or something. Is that kind of what you think too, Janelle?
Yeah, that's actually, I didn't get to the KCP&E meeting itself, but I was at the joint meeting and that question was raised. And thank you, Christina, for bringing it up, because I basically said that to them, is that as far as I knew, that we were planning to continue with that grace. I think some of the question came up, ASIN is requiring anybody who's continuing to make or do changes from what they currently is in their plan with ASIN, is they're having to do, or I think the plan is that they're going to be doing substantive changes for that. But I said, as far as I knew, at least through the end of the year, we were good with that, and I hadn't heard anything different. So I think it's good it's brought up. That I think that kind of confirms the path that I set. But I also said too, if it came up with the group here, if there were any changes, that we would let them know. But I agree.
Yes, if it would make the nursing programs feel a little bit better, it could be discussed at the board meeting tomorrow and come out, as kind of guidelines from the board or something like that.
Right. I think that would
Get
help
information out. It's up to you all.
I think that would be beneficial if it could just be discussed and reiterated. I think there's a level of comfort that goes with that. And just a point of clarity for our regulations do say you cannot have 100% virtual or simulation clinicals. You do have to have face-to-face clinicals. So, because I know that's a question that several people have emailed me. So just regulations are regulations and you have to have them. So.
And I've cooperated that with those that have sent them to me as well, Christina.
So I could speak to the programs as an example. One of the things that every program I'm sure is discovering is that there are different ways to deliver that content, and we're making it work, and it's working quite well. And so brick and mortar is changing a little bit, if you will. Some things that will work, and we may keep some of those things just to help be more accessible to students in some ways. I'm old, I have gray hair, so I'd like to just keep it like it's traditionally been. But we are finding some positives in the other end of that. And so a decision will have to be made. And yes, I think most schools are scrambling, trying to get that kind of solidified, what they want to keep doing. I'm also guided by my school. My school is saying, these are your options for school and delivery, and this is how you're going to deliver it. Now, they don't take clinicals away from us, of course. They're going to let us do that as long as we can get to the facility. But they're setting some parameters on me also as to, I have 4 or 5 choices for delivery. I have to say what delivery I'm going to use. And so with all those chiefs up there, it's a little difficult, but most schools are figuring out what they like, what works, what doesn't work, what the faculty like, what they don't like. Faculty that I have, they'd work from home for the rest of their lives if I'd let them, right? But that's not a good way to mentor students, especially in my associate degree nursing program, to mentor students through this process. So it's a real question. As administrators, we'd like a firm answer that tells us for the rest of time, this is what the board is going to do, and we just can't do that. So we'll talk about it again tomorrow at the board and get some input from that and maybe some more clarification.
Thank you.
See where we go from there. So anything else? Christina's got through her list, so now she can help make the motion to adjourn. Go ahead, Chelsea.
Move to adjourn the Education Committee meeting.
I will accept that motion.
I will second it.
A motion second, any discussion? All in favor say yes,
Yes.
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 and all opposed say no. Looks like the motion carries. Thank you very much for your time today.
Thank you.
Thank you.
Thank you.